Okay, my 2 cents or inputs in this whole health system thing and foreigners in South Africa. Let me give my 2 cents. Let truth be told, South Africa has tried. Let truth be told, South African healthcare system, they have tried. They have tried. If they're saying we can't do it anymore, please, no one should now start getting upset and saying, as South Africans, they're chasing this. They have tried. As someone who was in South Africa, who lived, who schooled there, who did some things there in South Africa, I will say, I gave birth twice in South Africa. Twice. I had 2 children in their government hospital via CAS, 2 CS operation, cesarean. I did not pay 1 cent. 1 naira I did not pay. I did not pay. It was free. I was shocked myself. When I was discharged to go get my discharge and then to go clear my things at the logistic and whatever, we were there to go and pay. They said, no, it's free. We were like, because in my country, Nigeria, it's not free. It's not free. You will pay. Especially CS is even the worst. You will pay so much money. People borrow money. People cry. People even say, oh, no. When it comes to CS, no, my wife will push. My wife will give it as a Hebrew woman because of the payments. It's expensive. I gave birth to the second child. The same thing. I was given food 3 times a day. Free food. 3 times a day. I went to antenatal since it was considered high risk. I start first from the clinic. They did my blood test, everything free. I didn't pay. And from there, I was transferred to the hospital to continue my antenatals there. I didn't pay. Doctors were seeing me all the time when I go there for my consultation. I did not pay. It was free. Till I gave birth, till I was admitted for a week because they were expecting the baby to just, I exceeded my labor dates. So they said, no, they can't take that risk anymore. I should be admitted, monitored, and all those things in the hospital. I should stay there. I stayed for close to a week, more than a week plus. And the baby couldn't come. The labor didn't start on its own. So they said, no, we can't risk it anymore. We have to take you in for operation. They couldn't also stimulate the labor because of my previous seizures. So they had to just go in for cesarean section operation again. And I did not pay. Antenatal, US, everywhere, you pay. Most of the places in the world, you pay. It's not free. I did not pay. I went to Ghana. I moved to Ghana. I gave birth in Ghana. I paid. My children, they're fighting. I'm coming back. So, I was in Ghana also. I paid. It was also CS. I paid for my medical cover, paid for everything. Everything was paid for. I got Ghana health insurance. I also got it all for my children, so that if anything, we can use it. So if South Africa, they're saying they've tried, it's putting a strain on the system. It's too much people compared to the people they budgeted for, which were the citizens, which they carry out their groundwork. They know the number of citizens that are supposed to use this particular clinic. It's okay. Don't get upset with them and say, they don't want it. No, they've tried. They have tried. You know in your country it's not free. You know it. It's not free. You know it. They've tried. What you can do is look for the most affordable, cheapest health insurance you can get. Look for it and get it and use. Or health insurance, the most affordable, the least you can get it and use. I remember when we were traveling to Norway, we were not given, part of the requirements was, even though it was a 3 week trip, we got health cover for that 3 weeks, for that duration. You're not allowed to travel without it. You said no, you must cover yourself. What if you're there and you get sick while you're there? They're supposed to take care of you. So we had all those things when we were traveling. Please, not every time we now say, oh, it's xenophobic. Sometimes, let's just say the truth. They've tried. They have tried. Okay?